India's healthcare system is contending with another disease, dengue fever. There's an outbreak across northern India. In the capital of Delhi, some hospitals are running out of beds and doctors are turning away patients. Sound familiar? DW's Namisha Jaiswal has more.
Delhi hospitals are filling up again. This time with dengue patients. Doctors say complaints of high fever and body aches spiked in October. Over 1,000 cases have been reported in Delhi alone. When 15-year-old Kumar Kunal experienced what he called the worst headache of his life, his mother travelled over 500 kilometers from the state of Rajasthan to bring him to this Delhi hospital. Soon after, she was diagnosed with dengue too.
Dengue has spread widely where I'm coming from, and there is a shortage of beds. Serious patients are being referred to Delhi anyway. When I got sick, my father decided we should directly head to Delhi.
Kunal's mother wasn't hospitalized at first, as the limited beds had to be reserved for more critical patients. It was only when her condition worsened that she was admitted in a shared space with her son. She was lucky. Doctors here say 9 of 10 dengue patients have had to be turned away. Cases of dengue have shot up across North India. The worst cases report symptoms like high fever, vomiting, hemorrhaging, and organ failure. Dengue can be fatal. There is no known cure. India has struggled with dengue almost every year after the monsoons. Still bodies of water provide ample breeding grounds for mosquitoes that carry the disease. After dealing with India's massive second wave of coronavirus cases earlier this year, major hospitals are now scrambling to accommodate dengue patients.
There were some beds which were kept for COVID. No, since COVID patients are low, we kept that also for dengue. We created another flu ward also, which also now being used for dengue patients. And many more people who are waiting for admission. And these are all who are with a complication.
The Delhi government has now ramped up fogging drives across the city. It has also called on people to regularly check for mosquito breeding grounds around their homes. But some doctors say these measures should be in place all year to stop recurring outbreaks. Coming at this late stage, these efforts may be too little, too late.
Joining us from Delhi is Ramel Tikku of Max Healthcare. Welcome to the program.
Thank you. Thank you so much for having me.
How worried are healthcare workers about the rise in dengue cases and the ability of the medical system to potentially deal with yet another spike in COVID cases? Would India, I wonder, be able to handle both?
I think we're well prepared in case the numbers go up. And post the festive season, we've always seen that the numbers do go up. But we're doing well at the moment. India's had less than 20,000 cases for more than a month now. And even the mortality is pretty low. So we are pretty sure that we'll be able to handle it. But this is sort of a double whammy where we've had an increase in the number of dengue cases as well, especially in North India, the UP and Delhi. UP's had an outbreak in the last 2 months where a lot of patients got infected with the deadly dengue 2 strain in Firozabad, and there was mortality also, especially in children. But things are much better now. And we're ramping up the testing, the infrastructure, and everyone who needs hospitalization or medical attention is being taken care of. But having said that, the coming few weeks are very important because, one, because of the festive season, the numbers of COVID also might go up, plus the dengue is always there. But hopefully with the temperatures dipping in, and we will have some respite from dengue, hopefully in the next 2 weeks. But till then, we have to be on guard. We don't have to get complacent because we've seen what these viruses can do.
And of course, you mentioned the testing. Our report reminded us that some of the symptoms of dengue overlap with COVID, fever and aches, and that will mean testing. Are there enough testing kits out there?
Yeah, there are enough testing kits available. We've ramped up the testing, as I told you earlier, even the infrastructure is being ramped up. There is an overlap of symptoms because it's an influenza-like illness, whether it's COVID, whether it's dengue. But the clue is in testing. If you test initially in the first 2 days, there's a dengue NS1 antigen test, it comes positive. So you can take adequate precautions. You have to stay hydrated. You have to keep a track of your complete blood counts and platelet counts as well. So one has to be very vigilant. One has to be proactive. If you have fever, in the first few days itself, you should get tested for dengue.
Right.
And that's how you differentiate it from COVID.
Ramel Tiku, thank you so much for joining us.
Thank you so much.